Vision for the Warneford is to really create modern, purpose-built, designed environments to replace the 5 ward areas that we currently have over time. So certainly focusing on the 4 wards which are currently the old estate, which was built in the 1700s. And the reason for needing to change those environments, there are a few key points that I think it would be important to cover. Firstly, in terms of improving patient experience, because the wards currently, in terms of their old design, they really don't have a lot of space for association, for people sitting in sort of modern sitting rooms and environments, places to eat which aren't cramped, and generally in terms of opportunities to mix in different sorts of spaces. So some small meeting rooms for one-to-one work, group rooms, rooms for clinical teams to meet. And currently we've got lots of multi-purpose rooms and the environment is very, very cramped. It is also important in modern mental health care to have purpose-built environments, which we don't have currently at the Warneford, to ensure that you build in the safest design specifications for modern mental health care. The most important area in that is probably to be as ligature light as you can, and you build that into the design in modern buildings. You design your windows in certain ways, you design your doors in certain ways, you design the rooms in different ways, the furniture, and particularly things like the bathrooms in certain ways. So the way that you design the building, you think about how you want to run that environment in the safest way and the most comfortable way possible. And if you go back into what we've currently got at the Warneford, we have done a lot of development where we can within the confines of that building and all of the restrictions that we have, but there is still an awful lot more work that we would need to do. Another area is privacy and dignity, because modern wards are very much more in mental health care based on what you would expect when you go into a hotel, and would have ensuite facilities, or at least the provision to be able to use ensuite facilities. In our wards at the Warneford, you have bathrooms which are shared, and clearly toilets which are anyone can use. So the privacy and dignity angle from a bathroom point of view is important, and also from everyone currently does have individualised bedrooms. Some of them are much bigger than others, and the size of your bedroom and the size of the space you've got when you're not feeling very well is incredibly important. Also in terms of the sight lines for particularly nursing staff in our current environment, certainly the bedrooms they're designed in a rather higgledy-piggledy way, and there is not clear lines of sight, whereas in a modern and purpose-built design building that would be different. You can build fabric in terms of that will absorb noise and other things which currently our buildings don't accommodate.